Good evening. Thank you for joining me tonight. We're going to be talking about loving your bones, preventing and managing osteoporosis. My name's Brigit Hallam. I am not a doctor, so I'm not going to be able to offer too much medical advice, but I am happy to answer any questions and do any follow-up if you do have questions. I believe we have a chat area, so you're free to ask any questions, and we can answer those at the end. Our bones are amazing pieces of our body. They do so many things for us. Tonight, we're going to bone up on osteoporosis. We're going to define our osteoporosis. We are going to learn some impressive facts about how crazy and amazing bone is. We are going to learn about some osteoporosis risk factors, and we do have some common misconceptions that many people have about exercise. I might even throw in a few exercises to show you. There are some different types of fractures that you can develop in your lifetime based on bone loss. So I'm going to go over a little bit of those fragility fractures versus trauma fractures. Many people have some confusion about calcium and vitamin D. So I'm going to go over some of that with you and explain why they're both important for our bodies. The last thing I'm going to talk about is some of the procedures that we have that can help determine the type of bone loss you have or how you're getting bone loss. And some of those tests are, one test that I'm going to go into is the DEXA test. The first thing that I need to do, that I want to talk about, is what is osteoporosis? Well, the World Health Organization tells us that osteoporosis is a bone disorder that is characterized by compromised bone strength that predisposes us to an increased risk of fracture. That's a lot of words in there. Let's break it down a little bit. To understand what that means, you need some basic knowledge about you need some basic knowledge. Bone is a complex network of bands and network that are bound together, and they keep our bone structure sturdy. They keep us healthy. Sometimes those bands can break apart and they can become weak. When the weakening happens, they become what we say porous. They have holes in them. It's a little confusing, but if you're still lost, the best way I can explain it is by taking a look at a sponge. A sponge, when it's dry, it has a network inside here of these very tiny fibers that hold it together, and it keeps it strong so we can really get in there and grind into our kitchen cabinets and things that we need to be cleaned. But what happens is, as that sponge gets wet and it gets older, the pores get larger because the wetness creates a weight in the sponge, and the pieces of the network in here break off. They can lose their shape. The sponge will wither away until it's nothing there. Why is this important to understand, do you say? Well, because 28 million Americans have osteoporosis. It's a very serious and it's very common. A lot of people do not understand how big it affects our lives. 18 million more people have low bone mass. And women over 50 have a 40% risk for a fracture of either their wrist, their hip, or their spine in their lifetime. And that is only due to osteoporosis. That doesn't even account into if they were in a car accident or they fall down the staircase. 20% of people with a compression fracture, and we'll talk about compression fractures on another slide, they are at a higher risk of having another fracture within a year. The other factor is 300,000 hospitalizations occur each year because of hip fractures. 250 of that is just from a wrist fracture, and believe it or not, 700,000 people are hospitalized because of vertebral compression fractures. I know this is scary, and I actually do want to scare you a little bit. Fractures due to osteoporosis are called fragility fractures, as opposed to a trauma fracture. They can change the quality of your life because even though the fracture is very tough and it's hard to get through, Osteoporotic fractures can lead to pneumonia, infection, and more fractures. They can sometimes even lead to blood clots and death. Now, think about that for a second. You don't die from the fracture. Your death is not caused by your fracture. It's caused by the complications that the fracture ensued. I want to go over some of those risk factors of bone loss. I got this slide from some of my friends a while ago, and it's basically an acronym that allows you to remember so you can think about it and know what your risk factors if you forget them. Osteoporosis, access is the first acronym, and it leads to osteoporosis. So if you can remember access, that it leads to osteoporosis, it will help you know what some of your risk factors are. One of the risk factors is A. A is alcohol use. Too much alcohol, not so good. But you can have some. There are studies that show that alcohol that has some benefits. C is for corticosteroid intake. When you have certain diseases that require you to take prednisone or steroids, that can decrease your bone strength. C, the second C, is for calcium. When your calcium is low, you obviously are going to lose bone. The E in access is for your estrogen levels being low. Estrogen plays an important part in maintaining our bones' health. The S is for smoking. Smokers tend to have a breakdown of the bone infrastructure, so you don't want to smoke. And then the second S is for a sedentary lifestyle. So it's important that you get up and you walk around. The second acronym that we have for osteoporosis, which is sometimes a little bit easier to remember because when you think of osteoporosis, a lot of people think of brittle bones. So that, of course, that acronym is brittle. Brittle, the B stands for body weight. When you have low body weight, it can also be a risk factor. We'll go into that in some more detail later. R means it runs in your family, or you have family hereditary risks that can cause osteoporosis. I in brittle means that osteoporosis does increase with age. The older you are, the more risk you are of developing low bone mass and osteoporosis. And like we said, the T is for too little estrogen, so we know that, and the other T is for too little calcium, which we've already covered as well. L, which is also the C in access, goes along with a long-term glucocorticosteroid medication. E in brittle is excessive alcohol use. So the two go kind of together, hand in hand, but one of them might be easier to remember than the other. Now that we've talked about some of the risk factors, I want to take a second and just define some words. Some people confuse osteoporosis with other words that begin with osteo. Osteo is a prefix based back from our Latin predecessors that make medical terms just hard for us. So osteoporosis means you have bone loss. Osteoarthritis is a common term that usually occurs in people over 65, and it can affect their joints. It usually affects, most often, their fingers, their spine, and their hips. It can be caused from repeated trauma as well. It can cause a lot of stiffness and swelling in the hands and the joints. So you'll know if you have osteoarthritis. Your doctor can run blood tests and tell you if you have that. You also have some crippling of the joints. The other one is osteomalacia. Osteomalacia is a condition that can cause the fragility fracture, but it's not as common as osteoporosis. It can decrease bone mineralization. And what do I mean by that? There are some very important minerals and vitamins that we use in our body and hormones. When those are low, like vitamin D, calcium, phosphorus, it can cause problems and cause this disease called osteomalacia. The bones tend to be very soft and brittle with osteomalacia. And then, of course, there's osteopenia. Osteopenia is used in conjunction with osteoporosis, but osteoporosis is the actual condition. Osteopenia is more of a quantitative number that you get off of the DEXA scan that tells you how much bone loss you have. So I tell you this because the next time you go in and you are having a bone density test or the doctor's asking you a health survey, you can be a nerd like me and look at that health questionnaire and go, oh, I know what those mean. It's really important that you know what they mean so you can help yourself. Like Rome, bones were not built in a day. Bones take a very long, they're constantly changing, they're rebuilding themselves. They go through a process called modeling and remodeling. When I think of a skeletal system, I think of a scaffolding on the side of a building. Well, that's very far from the truth because bones are a living organism. They constantly change, they're constantly moving around, and over time, even in children, they can, the bones actually grow in the length, and they can change in shape all the way up until the 20s. When we reach that peak bone mass in our early 20s, that's the time our bones are getting through this modeling and reforming process. They form new bone, which is the outer part of the cortex, or that thin part of the bone, and on the inside, the bone is being resorbed. And that's the trabecular part of the bone, the network, like in the sponge, the network or the fibers of the bone. That resorption occurs to about age 30. At 30, our bones do not grow, they don't change. It's the end-all be-all for the most part. They do continue to break down. So they break down old bone and then they replace it with new bone until about 35. But at 35, you're done. It's the end of all the bone that you're ever going to build. At that age, you've amassed every amount of bone that you're ever going to have in your entire life. So this is why it's important to be sure that you are doing everything you can constantly do throughout your life. So I want to go over some cortical bone and trabecular bone that I just talked about. So cortical bone is the outer part that we talked about. It's very dense. Not dense as in dunce hat dense. It's dense as in it has a lot of strength. It surrounds the bone and it makes up about 75% of your skeletal system. It's mostly in your arms, your ribs, and your legs. And it can regenerate very slow. It's about 2 to 3% a year. Women can lose 40% over their lifetime of this cortical bone, and men can lose a lot less, 5 to 15%. What's up with that, guys? Trabecular bone is not dense. It's spongy, like that sponge. It has lots of lightweight material and is very porous. It is the inner shell inside the cortical bone that it is made up of those plates and rods. They are arranged in a very complex network of patterns, and it makes up about 20% of our bone mass. That's usually found in the spine, the pelvis, and the hips. And that's the area that we're looking at when we look for bone loss in osteoporosis as well. It does regenerate quickly, about 25% a year, but women still lose 40% over their lifetime, where men only lose 15 to 40%. There we go, men. Why is this stuff important? Because children are our future. It's important to know that this information you can carry on to your children, your grandchildren. Adolescents need to take more of their calcium at a younger age than adults do. The intake of calcium on a recommended dose is a minimum of 1,000 milligrams of calcium, and that can contribute to optimal bone mass. I wanted to point out, if kids spent 1/100th of the time building good density in their bones up to the age of 30, they would never have to decide which medication they needed to cure osteoporosis. They just have to do 1/100th of the time a day just building good peak density. And then they never have to worry about that osteoporosis. Experts say that our children are more prone to osteoporosis in the future because especially because of this pandemic we've been in. They're reading, they're spending time in their house, they're reading, they're not getting outside, they're not moving around, they're playing games. So it's really important that you be an advocate for your children or your grandchildren, and you make sure that they take them out for a hike, go bowling, do fun stuff with them so that they can learn to be advocates for their body. Let's see. There are many hormones that can keep our bones in balance. Some of the bones that relate to bone loss are vitamin D. Now, let me take a step back. I was not aware that hormones did anything for us except maybe help us through menopause, make sure that we don't have hot flashes. Well, not that I would know that, but other people know that. But I did want to let you know that I did learn a lot of stuff when I was reviewing on these. Hormones are vital for bones. One of the biggest vitamins that we have is vitamin D. Vitamin D is critical for our bone mineralization. It is absorbed through the skin through sun, but if you have an overcast day or you're using too much SPF, you got to be very careful because you want to make sure you're getting the right amount of vitamin D. PTH is a parathyroid hormone. It's made up of these 4 small glands that are called the parathyroid gland, and they're located really close to the thyroid. They regulate the amount of calcium absorbed in your diet and how much the calcium your kidneys need and how much calcium your bones need to store. Calcitonin is another vital hormone. Calcitonin you may have heard of because they used to give out calcitonin as a first defense for osteoporosis back in 1970. But it is a natural hormone that is produced in our thyroid gland. And it inhibits our bone removal, and it does promote bone formation. Estrogen, again, here we are back to estrogen. It obviously regulates our menses. It helps us through menopause, but it also works with that PTH, that parathyroid gland, and it helps keep our calcium in balance. Estrogen is one of the most important factors of fragility in menopause. Women can lose up to 30% of their bone mass in the first 5 years after menopause. So it's super important that you're taking your calcium, and you know that when your estrogen levels are low, that you're increasing your calcium levels. Testosterone's not just for men. It can help us maintain our bones, it can help maintain our strong bones, and it can work our muscles, and it helps keep bone formation for us. It's quite amazing that hormones do all these things for us that I never even knew. Just like hormones, there are minerals that are very important to our bodies that we need to create a balance. 2 of the more common ones are calcium and phosphorus. They work together, and they maintain this constant balance of a constant balance ratio of calcium and phosphorus. Without that balance, osteoporosis can occur. Calcium is one of the most common minerals in our body. I know many of you know this, but just to remind you, there are 206 bones in our body, but did you know that as a whole, they contain 3 pounds of calcium? Crazy information. Phosphorus is is the second most important mineral in our body, and it makes up 85% of our body, and it's stored in our bones and our teeth. I didn't know that. Intaking proper vitamins, minerals, and hormones are very controllable, and those controllable things we can do in an easy format as long as we're aware of them. So that's why we get together and we talk about these things, so you know the things that you can control. Let's talk about some of the things that you can't control. Well, you can't control being a woman. Women, even if you do everything right, there's going to be a time where there's nothing you can do to stop osteoporosis. These uncontrollable risk factors are things that you can't change, obviously, but I want you to know about them. 80% of osteoporotic patients are women. 80%. 20 to 30% are postmenopausal. Men start that bone loss at a very slow rate. And when we lose estrogen after menopause, that accelerates bone loss, especially in that first 5 years. So your doctors will do a hormone test and find out where you are in your estrogen loss, and they can help you set up a treatment plan for how much calcium you should be taking. Age. Until about age 30, a woman builds more bone than she loses. After about 35, bone loss continues to occur, though. The American Medical Association states that 1 out of 2 women over 50 have a bone fracture related to osteoporosis. A 50-year-old woman has a 14% risk of a hip fracture before they die. Isn't that crazy? Family history. We kind of talked about this a little bit before, but I want to go into a little bit more detail. It's important that you're an advocate to your children for your family history. It can increase your odds of assessing what you need to do to be proactive about that. Some people don't know about their family history because they were adopted, or they just don't have a family member, a mom or dad maybe has passed away, or they're living with their grandparents. I have a tip. If you look in the photo albums that you have, you can look to see if Aunt Jane got a little bit shorter, if grandma's got a little hump on her back, if you're towering over your father. You can also see if maybe Uncle Bob had a bunch of crutches over the pictures that you're looking at. Those all are indicative of bringing up a discussion about maybe they had bone loss. Maybe I need to talk to my doctor about that and find out if those are things that I need to be proactive about. I want to tell you too that it is common to lose height, about 3% a year. But if you lose more than 8 inches, then it could be a sign that there's something going on. The other thing that we talk about is regarding family history is ethnicity. Some ethnicities have a higher risk factor, and we ask this question when we do our bone density tests at the office. And one of the questions that we always get from the patients is, why do you need to know this? Well, African American women sorry, my brain went crazy there. African American women and Mediterranean or Latino women have a lower risk of developing bone or osteoporosis, but Caucasian and Asian women tend to have a higher risk of developing osteoporosis. Did you know that women with red hair and fair skin have a higher chance of developing osteoporosis? And women who have early onset of gray hair, don't look, they have a higher risk of developing osteoporosis. Thin women, which is one of our other factors here, weight, thin women, thin is, in most categories, it's based on your BMI. However, in the case that we're talking about right now, women who weigh less than 127 pounds at any height are considered thin. And those women usually are women who have gone through excessive dieting, they've had anorexia or bulimia. Those people are more than 3 times more prone to developing a fracture in their lifetime. This may lead to inadequate calcium intake, inadequate calcium intake because of their diets. Menses is something that can stop bleeding, may stop estrogen deficiency and can create osteoporosis. Your BMI is a formula that we use that can assess your risk of bone fractures. It takes a calculation of your height and your weight. BMI of less than 20 is definitely associated with a risk of increased osteoporosis. Studies show that anorexics have bone loss during that peak bone time, around that 20, and then once they lose it, it's very hard for them to get that bone mass back. Overweight women have actually a less risk for developing osteoporosis because the fat cells produce estrogen, and estrogen, as we know, helps us with bone loss. There are other environmental factors that we take into effect. Most of that is relating to the type of medications that we take. Some medications like prednisone and thyroid medication, some anti-seizure medication, they all can cause problems within the blood and can make your calcium a little bit thinner. Can make your digestive system and problems within the your system, your overall systemic effects to your body. And the body can also have GI problems. When you have GI problems, your absorption doesn't work and you become malnourished, which creates problems when you want to intake calcium. You have to intake more because you're having inflammatory bowel disease or ulcerative colitis. Those things make you lose, excrete nutrients, and therefore can decrease your calcium in your body and lead to osteoporosis. Some people who have bariatric surgery, they can lose weight very quickly, and it can have an 80% drop in their bone density about 6 months after their surgery. So it's important that they're getting the correct amount of absorption in their bodies. Celiac disease is also one that can damage the intestinal lining, can become damaged, and it can affect your absorption of calcium. How do we make up for some of these uncontrollable risk factors? Well, that's easy. We eat. We eat to maintain what we have. Supplements are good, and we'll talk about that as we have, but eating is the best way to get the most nutrients in your body. Your calcium intake is really based on the type of how old you are, depending on your age and your medical background, and your doctors can go over that with you. The recommended amount basically is more than 1,000 milligrams a day. Milk is surprisingly the best type of calcium in our body. Beans, fruit, grains, tofu, all those are also very good sources of calcium, and they're non-dairy. Salmon, sardines, cornbread, and eggs are also good ones. What happens if you're lactose intolerant? Well, lactose intolerant is when the body is unable to break down the main sugar found in milk. So they do have things now that you can take, like lactate, soy milk. You can take lactate tablets that help you. But I bet you didn't know that they make yogurt now that contains a bacteria that helps you digest lactose. You can also eat hard cheeses like Swiss cheese, and because all those are very lactose free. Vitamin D is a very critical part that we need, like we talked about. It is something that you get in the sun, and there is a minimum requirement, about 200 international units a day is what they say vitamin D should be. Vitamin D doesn't work unless it is processed properly. So you need to have calcium and vitamin D together so that they can do what they're supposed to do, their job. Potassium, if your diet's low in potassium, your body may pull calcium from your bones, and therefore it can cause a problem in bone loss because it's pulling too much out. Potassium can be found in fruits, vegetables, milk, even yogurt. Salt, sodium. No more than 2,400 grams of sodium a day. Now that seems like a lot, but to put that in perspective, 1 can of low sodium soup can have 420 milligrams. You can only have 2,400, so that's a fourth of it. Protein. Women need a lot of protein in their body. However, too little protein can weaken your body because it makes the body, it can weaken the bone and make it slower for recovery when you have a fracture especially. Too high a protein excretes calcium in your urine, so you have less calcium in your bones. Well, what else can we do? We can exercise. I know, the worst thing you can do, exercise. There's some misconceptions about exercise. Misconception 1 is exercising with osteoporosis can be dangerous. Well, if you do the proper types of exercise, it can actually strengthen your bones and decrease your risk of fracture. Misconception 2, physical activity is going to wear my bones out faster. Well, that's not true. When your muscles pull against bone, it's attached. So during exercise, it actually stimulates your bone to rebuild and it becomes stronger. So the more you exercise, blood can continually flow through the bones, and that results in nutrients for the bone growth. When you build muscle, you build bone. Now, exercise may not prevent you from losing bone mass, but it definitely slows our process. Misconception 3, I can only build bones and decrease osteoporosis by lifting weights. Well, weight bearing is an exercise where you put full weight on your legs and you use your bones and your muscles to work against that weight. Well, standing is weight bearing. Walking is a great exercise for weight bearing. Easy, everyone does it, you just track it and you make sure you're doing it. You don't want to be sedentary and sit on your couch though, that's for sure. The other type of exercise you can do is what we call resistance training. It's relatively new, and it's a type of exercise that where you pull and you push and you lift. That's what weight bearing is. Resistance exercise can help these bones because the tendon of the bone that is attached to it pulls the bone, and that supports bone building activity on a cellular level. Misconception 4. Well, I swim every day, so I'm getting good exercise without hurting my joints. Well, swimming is good for you, but water does not create enough resistance to allow weight bearing. So swimming, although it's good for heart and muscle tone, definitely does not prevent osteoporosis. And the 5th misconception I want to tell you is those women who say, I bought my exercise clothes, I've got my jump ropes, and now I've signed up for 25 classes at the gym. No, don't do that. Definitely talk to your doctor. Make a realistic plan for yourself. Some of the questions that you want to talk to your doctor about it before you start any exercise. And that way, when you talk to the doctor, they can help you be sure that you're doing the stuff that's building your bone and not breaking it down. One question you want to ask your doctor is, what are my physical limitations? Are there exercises that I should not be doing? And I'm old. How much exercise should I do? Some tips before you start. Be realistic. You may want to set aside some time for exercise. Start very slow. Work up to more stuff as you go on so that you don't have any injuries. If you feel like intimidated because you don't want to go to the gym, you feel like everyone's staring at you, find a gym that caters to women or bring a friend. You want to engage with the people at the gym. The trainer is a great resource, and most gyms now provide the trainer with your membership. Create an exercise plan. Pick a time. Start with about 20 minutes 3 times a week. Do a cardiovascular activity. Doesn't have to be anything super strenuous. Just get that heart level up. And then end with 15 minutes of weight training or that resistance training we talked about. Make sure you're targeting areas that are prone to osteoporosis, like your arms, your hip, and your spine. Dumbbells, you don't have to use dumbbells. You can use water bottles. Take a full 3 seconds when you lift that weight and lower that weight. And when you lift it, make sure you hold it for a second. Breathe slowly, exhale when you lift, inhale as you lower. Do only one set each exercise with about 12 to 15 repetitions. And rest between sets, about 30 seconds before you go into the next one. And each time you do an exercise the next day, make sure you're alternating your muscles to make sure that you're getting everything that you need to get. It is difficult one of the tips that I found is if it's difficult to do a repetition, more than 8 repetitions, then it's definitely too heavy for you. Lower it down, go slow. If you're having 15 repetitions and 20, definitely too light. Increase it, okay? Now, I think it's important that we do a demonstration. One of the things that you want to do when you exercise is, when you're sitting, is to make sure that you're in a nice, comfortable chair. You have a towel underneath your legs so that it can provide support for your back. So you put this under your legs, and you can do simple exercises like lifting your legs. This is weight bearing. You're lifting them up, you're going against the resistance of the rest of your body. And you do, 12 to 15 of these repetitions. You can add weight to the ankles if you need to, and as you get better at it. Another thing that you want to do is you can take your water bottles. I happen to have some weights. And you take one, and you just do curls. And remember, you want to take 3 seconds to lift that weight, 3 seconds to lower that weight. When you lift that weight up, you hold it for a second, and then lower it down. This helps build the bone. Do this for 20 to 30 seconds, or 12 to 15 repetitions, and then alternate. Do the same thing on this side. And if you go on YouTube or Google or anything nowadays, you can find lots of exercises where you don't have to go to a gym, and you can sit in your chair. You can watch TV. You can put books on your lap, and you can do your exercises. You can alternate one leg at a time, see how high you can get it. Some of the important things that you want to do is make sure that your stomach is tucked in, your back is straight. You don't want to put any undue load on any of the other parts of the body. And of course, if you have any questions, send me a chat, and I am happy to send you a big list of what the best exercises are. Okay. Some of these facts that I found so amazing. Did you know that a hip fracture doesn't occur in hip? It occurs in your femur. The femur is the long bone where your thigh is. And it is specifically breaks in the neck of the femur. The neck of the femur is the area where the hip, the head of the femur, and the hip joint meet. And there's this little tiny piece here, and that piece is called the neck of the femur. Many people think when they have a bone density, and we tell them that you have a bone loss in your neck of your femur, they think we're talking about the neck, the cervical neck. But no, it's the femoral neck. And that area of that femoral neck, that's where we break it because it's very, very weak. And crazy, that neck is the longest and the heaviest bone in the entire body. Can you believe that? And it breaks because, but it's attached to the biggest, the femur is the neck is attached to the femur, and the femur is the longest bone in our body, and it's the heaviest. And that area that's the thinnest part of our body, that femoral neck, is what breaks. More than 300,000 people fracture a hip a year in the US. Because of immobilization, when they break that, the area cannot be casted. So mostly surgery is always necessary. Many cases, people don't fall. This was a very interesting fact. Many times when you break something, and when you have osteoporosis, people don't fall and break their hip. It's actually the hip breaks and then they fall. That's why osteoporosis is called a silent killer. And that's the difference between a fragility fracture and a trauma fracture. Many women or men, when they're walking down the street and they see a rock or they trip on something, they're actually, that hip is actually breaking and then they fall. So it's not the fall that created the break. Some of the studies show that about 35% of adults over 65 will fall once or twice a year. They don't even know what caused the fall. About 50% of those people over 60 will fall at least once a year. That's a crazy statistic. So it's important that you are aware of this so that you can help yourself or your grandparent when they're walking down the street or they're crossing the road or they're getting in and out of the car. Osteoporosis, which is the other crazy thing, osteoporosis is not painful at all. It's only painful when you get a break. I want to talk about age and compression fractures. We talked about a little bit, but I want to explain what it is. A compression fracture is in the spine, and it's when the upper body exceeds the ability of the spine to support the load. So it changes the height of the body, of the vertebral body, of one or more of the spinal column, and that results and that can cause up to 5 inches in your height. Compression fractures can occur with no trauma, and 30% of them occur when a person is in bed. With severe osteoporosis, you can sneeze, you can break a rib, you can cough, you can lean a certain way, and you can you can break your back, you can crack a rib, you can pull something from your cabinet and break your wrist. So compression fractures are really come upon us very quickly. I want to talk about some of the things that can cause some confusion. Calcium. Calcium comes in many forms, and a lot of questions we get from patients are about what type of calcium should I take? Well, there's lots of different ones, and one of the most important things that you need to know about calcium is that calcium has to be attached to something else in order for it to work properly. So whenever you see an 8, ATE, an 8 on a calcium bottle, like calcium carbonate, calcium citrate, that 8 is what it's attaching to make it work. One of the things that's most important about calcium, whichever one you're taking, is a factor called elemental calcium. The elemental calcium is the amount of calcium that's actually absorbed by you. Elemental calcium makes up 40% of most of calcium carbonate. So calcium carbonate, we say, is probably one of the best ones to take. However, calcium citrate is less expensive and it is more easily absorbed. Calcium recommended dose is to take more than 1,000 milligrams of calcium a day, but again, it does depend on your age and what other factors that you have. Your body can absorb, interestingly, only 500 milligrams at a time. So it's important to take a 500 in the morning and 500 in the afternoon. Calcium carbonate is important to take with a meal, but calcium citrate can be absorbed an hour after you take a meal. If your meal has a lot of fiber in it, you definitely want to wait a couple hours before you take your calcium because you're just going to excrete it. You want to take a full glass of water whenever you take your calcium supplements, and you want to wait about an hour after taking the calcium before you take any of your other medication. There are some medications that can influence or decrease the potency when you take it in with your calcium. So be sure that your calcium one of the ways that you can check to see if your calcium is absorbing properly, or is not absorbing, but is dissolving, because it's one thing to take that pill, it's another thing for it to be into your system and it do its job. And some pills don't dissolve quick enough. And you want to know when that is dissolving so that you can eat and you can take your other medications. So one way you can do that is you put your calcium pill in a bottle of water, in a glass of water, and it should, without any chunks in it, it should be completely dissolved within 30 minutes. So a little tip of the day for you. So we talked about our calcium, and now we want to talk about what vitamin D does. Well, vitamin D, its function is to maintain that normal level of calcium and phosphorus in our blood. You only need to be out in the sun 10 to 15 minutes or for 2 or 3 times a week to produce the necessary vitamin D that your body needs. Interesting fact, African women of Middle Eastern and Asian descent have more vitamin D deficiency compared to our Caucasian women. This is another reason we ask about your ethnicity on our bone density questionnaire. The other thing that is very interesting to me is that as we get older, our skin is less efficient at synthesizing vitamin D. So as you get older, you need to take more vitamin D. Now, how do you know what kind of vitamin D how much vitamin D you need? Well, you do need to have a vitamin D level, and your doctor should be providing that at your annual appointments. I know at OCWMG, we definitely do that. There is a possibility that you can take too much vitamin D, and that can lead to vitamin D toxicity. So make sure you know what the level is that you need to be taking. That vitamin D toxicity will create problems with your calcium absorption because remember, they go hand in hand, and then it can lead to osteoporosis. Some of the questions, some of the frequently asked questions that we have is, we talked about, it's the best type of calcium. Calcium carbonate is, like I said, better absorbed, but calcium citrate calcium carbonate is better absorbed or easily more absorbed, but calcium citrate has more of that elemental calcium. Let's see. Bone, my eyes are drying up here. Some of the other questions that we have are, does osteoarthritis mean that I have osteoporosis? Well, actually, no. Osteoarthritis, like we talked about, is a little bit different. So remember, it's a disease of the joints, and osteoporosis is a disease of the bones. If my back hurts, does that mean that I have osteoporosis? No. It means that you have a problem in your back. Doesn't necessarily mean that you've got any fractures in your back that would lead to osteoporosis. I want to give you some good news, since we've talked about a lot of things that aren't great about osteoporosis. One of the things that's great about osteoporosis is that we used to think that it was going to happen no matter what as we got older. Well, today, that's not the case. We have ways to prevent, detect, and treat it. You're never too young, for sure, and you're never too old to take care of your bones. You may not be able to resorb after that age 35 and replace the bone that you've lost, but you can continue to maintain what you have by the things that we talked about: eating, exercise, diet, and making sure you're taking the right amount of supplements or you're eating properly. You also want to make sure that you have a good lifestyle. That lifestyle would require you to have to not have excessive drinking, no smoking, and those things do protect your bones and decrease your chance of developing any type of osteoporosis. You can also talk to your healthcare provider. If you haven't done that already, I definitely suggest that you bring it up. At our office, you can just send a message into our portal, and we're happy to answer any questions. You don't even have to come in for an appointment. There are some things that we do for bone to determine bone loss. One thing we do is we test for bone health. Good news is that osteopenia and osteoporosis don't develop overnight. And during menopause, you can start to lose some bone mass, but the risk of significantly decreased bone density is greatest right before and several years after menopause. And after that, the rate of your bone loss tends to level off. Well, how do I know if I'm losing bone density or just bone minerals? Well, like I said, we have several tools that can check the bone health. One is a blood test that can tell us the amount of calcium levels in your body and your bloodstream. And we also have different types of scans. The most widely and recognized one is the bone density test, the one that I've been talking about. It's commonly called DEXA, D-E-X-A, and the reason it's called that is because it uses two different energies. It has it uses a special low dose of radiation, and it measures calcium and the minerals in your bones to assess that bone strength. Bone density is measured at the lower spine and your hip. We don't need to know if you have it all over, we just need to know if you have it or not so that we can determine the best course of treatment for you. A DEXA machine uses a very low dose radiation, and it's an invisible beam, but it does use two different energy peaks. One peak is absorbed through the soft tissue and the other is absorbed by the bone. The amount that in the soft tissue is subtracted from the total, and what that remains is the amount of your bone mineral density that you have. You don't have to worry about that. Our machines do it and our doctors review it and they tell us where you are. So don't worry about all the nitty-gritty parts of it. You do probably want to know when you should get a bone density test and how often. Well, we do tell women that they should have their bone density test starting about age 65, men around 70. Remember, they have stronger bones. If you have any clinical risk factors like anorexia or you're developing fractures, then you may need a DEXA earlier. Women under 65 and past menopause should have a bone mineral test if they had any bone fractures that were because of fragility and not because of trauma, because they have other risk factors for osteoporosis. In DEXA scan, how often should you do it? The rule of thumb is about every 2 years, depending on what the results are. So if your bone density test, you come in and you have your bone density test and it's normal, and you're 5 years past menopause, where you have lost that 30% and that's over and it's peaking, then you can come in every 3 to 5 years. If your bone loss shows some bone loss, then we definitely want to have you come in every 2 years, because if you're going through menopause, we want to make sure it doesn't dramatically decrease and that we can help set up and monitor what you need to do to develop stronger bones. As we close, I just wanted to tell you a funny thing. I saw this cartoon. It talks about how they're finding these bones throughout the house. The husband says, yeah, he goes, well, and the wife says, yeah, well, my doctor tells me that bone loss is normal. So a little funny there at the end of our talk tonight. Thank you so much for joining me. I think I had a couple questions. Is that what this is? So one of the questions that we got tonight was, has Prolia been proven to help with osteoporosis? Does it have side effects, and what are options to take? I didn't go into really a lot of the medications because I'm not a physician, and so I don't want to give you the information incorrectly. But what I will do is I will find out about that for you. Prolia, what I have personally seen, has been effective with women osteoporosis. I actually have a friend who had osteoporosis and was doing a bunch of different things. She got Prolia, and it actually brought it up to osteoporosis, or osteopenia, or lower bone mass. It improved. Doesn't happen for everyone, but it did for her. The good thing about Prolia is that it's not parenteral. It doesn't go through the mouth. It's an infusion, so you don't have as many side effects with your stomach. There are tons of options out there. There's Boniva, which you take once a month. There's alendronate, Fosamax. There's all kinds of different ones, and I can give you a full list of all of those and what they are. Just message me on the portal, and I'll be happy to send that information to you. Second question is, are you familiar with OsteoStrong? It is a series of robotic musculoskeletal treatment devices to improve your skeletal system. Can these actually improve osteoporosis or prevent it from worsening? I've heard of OsteoStrong. I don't exactly know all the things that it does, but I will contact my doctor and find out what it works and what the implications are of it, if it's good or bad or pro. That's a great question. I've heard a lot about OsteoStrong lately. Do yoga poses help with stabilizing and bone building? Yoga poses are not that weight resistant or that weight training or resistance training unless you're using bands in your yoga. It is good for building tone and keeping your muscles attached to the bone. So in that respect, it is very good, but it's not going to help with your osteoporosis. Does having a thyroid condition contribute to osteoporosis? Yes, thyroid conditions can attribute to bone loss, but I believe it's based off of the type of medications that you have to take for that. But again, I'm not a medical doctor, but I will definitely find out these questions for you guys and get back to you. There is a couple more questions. At what age should you get a baseline or a bone health test, a bone density test? Hopefully we answered that question for you. You should be able to get it around age 65 as long as you have everything pretty copacetic in your system. We can start the baselines then. Will calcium lactate help? It's plant-based. Calcium lactate, I would imagine it does, just because it has that milk dairy product to it as well. I would imagine it's a good thing for people who are lactose intolerant. But again, I will get back to you. These are all great questions. I'm sorry I don't have the answers for you. But I don't want to just say something and it be wrong. So I am really excited that I was able to talk to you a little bit about bones and how amazing and intricate they are. So I really appreciate you joining to me tonight, and I can't wait to see you next time. Oh, where I work? Oh, I can tell you where I work. I work for Hogue Clinic, Orange Coast Women's Medical Group, and I'm the manager there for mammography and bone density services. I would love to have you come and see me. We have all kinds of exams, including mammography and gynecological health at our offices as well. Thank you guys, and have a great night.